On the west coast of Africa, between the nations of Sierra Leone, Guinea, and Côte d'Ivoire, lies the Republic of Liberia. For more than a decade, Liberia was devastated by a series of intense civil conflicts. Competing factions, corrupt leaders, and extreme acts of violence left hundreds of thousands dead, injured, or displaced. But now, 6 years since the last conflict officially ended, the country is well on its way to recovery. There's a new president, a new democratically elected government, and a new commitment to ensuring a brighter future. Hopes are high, but there are still many obstacles to overcome. It is often said that water is life. So then what happens when there is no water? When the only water available is unsafe to drink? When clean water costs more than you can afford? For many Liberians, this is life. Susanna Kofa has lived in Monrovia's SKD community for more than 20 years. Each day, she and her family rely on water from a nearby well to do their washing, cooking, and cleaning. This water is not suitable to drink, nor is it treated before it's used. But for individuals like Susanna Kofa, there's often no better option. As in other Monrovia communities, the majority of SKD residents rely solely on privately owned wells and taps for their daily water. Mark Falla has lived in SKD for 12 years. Ever since he fled from his hometown during the war. Considering that 3 in 5 Liberians survive on less than $1 or roughly 60 Liberian dollars a day, it's clear that costs do add up. But, as another SKD resident explains, it's more than just the financial price tag many people find difficult to cope with. Long queues, far distances, and fluctuating costs. Wilson says these are just a few of the struggles that members of his community face on a daily basis, all for water of unknown and largely unregulated quality. According to the 2008 UN Critical Humanitarian Gaps Report, diarrheal diseases are responsible for the death of 1 out of 5 children below the age of 5 in Liberia. This is one of the world's highest rates. And in Monrovia, outbreaks of water-related illnesses, including cholera, are a common occurrence. Slipway is widely known as a slum community. Although it's located downtown Monrovia, only a stone's throw away from major businesses and national ministry buildings, it lacks the infrastructure of more affluent areas. With no public toilets or reliable waste disposal system, residents of Slipway use makeshift latrines to relieve themselves. These latrines, perched over the Mesurado River, are precarious at best and empty straight onto the water's edge. This is the same water used for cooking and cleaning. The fish which live in it are caught and eaten. The general surroundings, home to hundreds, are polluted, and the germs and diseases they cause continue to spread. The cycle is a destructive one, and according to local health worker Vivian Copie, it's proving all the harder to break because it's a habit perpetuated by poverty. The Slipway Community Clinic, where Copie works, is supported by the government. It provides free consultations and free treatment. But as Copie explains, this is not always enough. On the day Copie spoke about these issues, the clinic had not been supplied with water for 7 months. Because they can't offer patients clean drinking water, Copie says in many cases, people take their free medicine with contaminated water, causing more risks for diarrheal diseases. In Liberia, the demand for water is high. And, as in any demand situation, the question of supply opens up a major business opportunity. In Monrovia, there are a number of different types of water for sale. The most basic is well or pump water. If there is no free community well nearby, private wells often spring up to meet the demand. This water is typically unsafe to drink, but at $5 Liberian, or roughly 10 cents for 4 gallons, it's the cheapest around. These water points can also mean valuable income generation for the residents in charge. However, in many cases, these pumps are being run by children who are missing out on valuable school time in order to work. Well water can also be purchased on the street, sold in jerry cans by push-push boys, named for the carts they carry around the city. So for anyone who can't travel directly to a well themselves, they can still purchase the same water, but at twice the cost. Or, if it's dry season and water's becoming scarce, for up to 4 or 5 times as much. Big bag water refers to cold plastic bags, sold on the street out of coolers or ice buckets. Although this water is untreated, it's still meant for drinking. Each bag costs $5 Liberian. Typhoid in a bag is one label jokingly used to refer to these sachets. Or, for the same price, purified mineral water can be purchased. Although smaller than the big bags, these sachets are treated to be safe to drink. And, when bought in bulk, the price goes down. Before the wars, pipe-based water was available to much of Monrovia. But years of neglect and damage caused iron pipes to rust, contaminating the water. The supply rate within the city, which was once 18 million gallons per day, fell to what is now just 1 million gallons. But changes are starting to be made. As part of its ongoing poverty reduction strategy, the new government is working together with local and international organizations to to strengthen the security and meet the basic needs of all Liberians. The construction and rehabilitation of water points throughout the country is one part of this strategy. This site, located in Monrovia's St. Paul's Bridge community, hadn't produced running water since the early 90s. The pipes are still there, only they're so badly rusted that they stopped working years ago. But now, in collaboration with government-owned Water and Sewage Corporation, Concern Worldwide is replacing rusted pipes with new PVC ones. When finished, it's estimated that 300 to 500 people will use water from this one tap stand every day. This water point, located nearby, was recently rehabilitated by the same project. For people like 16-year-old Makoya Kamara, this means shorter distances to collect safer water for her family. No more risk from running across the busy highway carrying heavy buckets, and more time for her school studies. In rural Liberia, there simply is no pipe-borne water. Although people who live in these areas don't usually need to worry about crossing busy roads to collect water, their journeys are no less risky. Pathways to creeks and rivers are often long and secluded, and with an extremely high incidence of rape in the nation, this certainly poses added risk for the children and women typically put in charge of fetching water for their families. And then there's the question of quality. Unsurprisingly, creek water is generally extremely dirty. Isaiah Barker is chairman of Dukalela Community in Bapalu County. Thanks to help from Liberia WASH Consortium member Tearfund, his community was recently provided a new well. The Liberia WASH Consortium is a group of 5 international non-governmental organizations. Contre Faim, Concern Worldwide, Oxfam Great Britain, Solidarity, and Tearfund are increasing water, sanitation, and hygiene services in rural areas, while helping government to improve its coordination and monitoring ability for the sector as a whole. In Dukalela, for example, this support has directly resulted in clean drinking water, a seeming luxury considering only a quarter of Liberians currently have access to this very basic need. AEL, or the Association of Evangelicals in Liberia, is a partner of consortium member Tearfund. By working with Liberian organizations such as AEL, the consortium strives to increase local ownership and participation in its projects, to build partner capacities, and ensure future sustainability. Through generous support from DFID, ECHO, and Irish Aid, WASH Consortium members and their partners work on a wide variety of projects. And with Solidarity's work reaching as far as southeast Liberia, consortium members are helping to ensure improved water and sanitation to even the most remote areas of the country. In Nimba County, for example, community health teams have been organized. Oxfam is leading government and other partners, including Contre la Faim, to engage in coordinating sector activities, with focuses including general health awareness and cholera prevention. In some cases, creative solutions are being used to encourage change, such as Action Contre la Femme's work with spare parts dealers to maintain wash facilities, or Concern's educational use of drama and song. In Bawoma, a small community in Bong County, young people are learning about the impacts basic hygiene practices can have on their daily lives, and they're speaking out to their other community members.